Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. Hope everyone's having a good day and you're not dealing with the smoke that I'm dealing with. I'm in Southern California, and even though the fires are still about 2 hours away from me, the soot, the ash, the smoke is just terrible down here. But my heart goes out and gratitude to the firefighters who are fighting those fires closer to up north and some down south. And we just really appreciate their efforts in this. It's terrible. My family lives up in the Oregon area, and they're also dealing with fires too. Some that I've heard have been set, which isn't good. So not just the global warming conspiracy theorist out there. There's all kinds of things going on. But it is hot here. We hit 100 again. So just pray for us that we get a little rain. I hear it's snowing in Colorado, and it's 100 degrees in California. Go figure. So today I wanted to give you I've been trying to do some news alerts because I know you don't always have the time to go look everything up. And I know we've had a lot lately, and some of you may be focusing on some of the things because it's an election year, things like that. But we still have to keep focus on our jobs and what's going on and what's coming. And I know last week I really talked about some of the proposed changes for telehealth, but I wanted to talk to you more about what is coming in 2021 for CPT because AMA released the 2021 code sets on September 1st. Also, just a couple of things. I just wanted to do kind of a quick housekeeping. If it sounds like I'm in a tunnel, I'm actually recording today from my laptop, which unfortunately my mic to plug it in doesn't work on the laptop. So I'm just kind of talking to a laptop, and it's warm in my house, even with my air conditioning on. So I have a fan going. So I apologize if it sounds just a little tunnely today. Hopefully it's still loud enough where you can hear me. I'm actually projecting a little bit. But getting back to our topic of the CPT, first I wanted to encourage everyone to get their new CPT book for 2021. I've already ordered mine. You can get a discount if you order it before October. And it's just a good thing that you want to get the AMA version, only because I know a lot of people or a lot of practices, sometimes some coders will get a different version. So for example, Optum 360 or APC or just a generic PMIC. I'm not saying those are terrible. I'm just saying that they're not as, what's the word I'm looking for? Well, let's just say it's not the source. And American Medical Association, AMA, they're the ones that actually publish and copyright the CPT codes. So when you are submitting claims or you're trying to argue a claim to a payer, you actually have the authentic CPT edition, and that's what I like. I like the professional spiral bound because it also includes diagrams and CPT assistant references and coding tips and things like that. So anyway, I would encourage you to get your current year because I know when I give presentations or webinars, and now we're going back to some in-person things, I know some people have dated material. So just because we've been quarantined, we've been, kind of pivoting to working from home and things like that, doesn't mean that you still don't need your updated information because right now healthcare is a very fast moving target and we need to be updated. So this came out of Chicago because that's where they have the yearly meeting. And it's the first major overhaul in more than 25 years for, as we know, the E&M services. So the office and outpatient evaluation and management. And they're really focusing on the 99201 to 205. And as you know, the 99201, which is a new patient visit, level 1 has been deleted. And they are now going to eliminate certain elements in the history and exam as far as helping you choose a level of service. But that doesn't mean you don't still have to have those elements. It just means it's not a factor in choosing a level, it's a factor in still proving medical necessity. So we have to be clear on that with our physicians. The physicians now do get to decide on how to level a code based on either time or medical decision making, but total time and now the code ranges of time may make it even more difficult to look at time as your constant when it comes to leveling a service. And they've also added some things for different codes and add-ons for prolonged services, but again, it's not what we consider prolonged service now. it's something that's going to change for 2021. And then there's also a new code that right now it's alphanumeric, but it's going to change in 2021 for a code for complexity add-on to a level 5. So just know that I do have my module and my 3-part series. You can find it on my website at terryfletcher.net. Part 1 is out. Part 2 is actually a little delayed. I apologize. Wanted to get the updates before I started on part 2, and and they're all on demand, and that will be recorded next week and available by the 18th of September. And then part 3, which shows you not only how to level, but how to audit a E&M service in the office, and that'll be available at the end of October. So you might want to check that out. So the revised E&M services and codes are among the 329 editorial changes in the code set, 206 new codes, 54 deletions, and 69 revisions. Now, when I say deletion, what I mean is that code has been retired. So it no longer exists, and they may have created a new code. Revisions means that the narrative description of a CPT code has been altered to either include other services, or it's taken out other services, or there could be just something as minor as a punctuation, like a semicolon or a comma, can change the meaning of a code. And so just know that that's definitely something to keep in mind as you look at some of the revisions and some of the different code sets. We continue to see growth in new and different areas of medicine. 63% of the new codes involve new technology that were described in Category 3. So we know that we have a lot of new technology codes, and also the continued expansion of they call it PLA, which is Proprietary Laboratory Analysis section of the code set. And then also part of the code set in the additions, new medical testing services because of COVID-19. I'm sure you saw a couple of the codes that they already became effective, and we'll definitely just kind of touch on that a little bit. So there's a lot of new things that are coming out when it comes to digital medicine access, and it's reflected in some of our new codes. There's also some new codes for retinal imaging and external extended electrocardiogram, so external ECG monitoring. We've got a new code for 92229 for retinal imaging, and its automated point of care. There's a revision of the code 92227 and 92228 that is for better supporting the screening of a patient that have diabetic retinopathy and increase early detection. And basically it's incorporating the findings into diabetic care, so I thought that was very helpful. We've got some technology advances in continuous cardiac monitoring. So we have new codes that start 93241 all the way up to 93248 in order, along with some associated guideline revisions for that. And those codes replace the 0295T, 96T, 7, and 8T, which what you're dealing with now is when we had certain Holter monitors as well that were more than 48 hours. So now they actually have some new innovative algorithmic technology that works in concert with a patch, and it's easier to wear for patients, gives you more accurate and complete data, and the physician's interpretation is much more accurate. Then it also looks like we have some new information, not just on the CPT assistant, but they also have some things on the RBRVS annual symposium to talk about fee schedule on that workshop as well. And then we also have a new section on the data file that talks about some codes that get into some of the digital and telehealth and remote services. So it's really important that when you look at some of these new codes and making sure you're understanding some of the new technology services that they're looking at, that you find out, first of all, is it something that you use in your office? And one of the things that AMA has developed, they really have a good online resource library. They've got checklists and videos and modules, and if your physician, belongs, which most do, you can log in and get in some of those services, and some of them aren't even something you have to pay for. So as long as you're a member, you can get access to that. There's also some things. One of the things that you can have is that it's called an insider's view. That's one of the new books that they have as well. And that's I like that book because it's like a companion to the CPT book. And what it is that it's a book that basically gives the changes. So once you get all the changes, it kind of puts the meaning behind a change. So it gives you, they call it the rationale on why certain codes changed. And so definitely something to consider and take a look at. And you can purchase it along with a package with the CPT book. So I know this sounds like a little bit of a commercial, but it's not supposed to. I just really want to encourage you now that we're at the mid-September and these changes you're going to have to implement really soon, that you go ahead and order your code books, make sure that you're on top of it. Otherwise, you just could find yourself in December and think, oh shoot, and now you're paying top dollar for your code book. So a couple of the other changes, we've got some SARS-related services, and these we knew. This was the COVID testing. So the 87635, that is one of the COVID-19 testing. That's the DNA or RNA. We've got 86328, and that's another COVID, and that's for the severe acute respiratory syndrome COVID 2, and then the 86769, that's the antibody test that I actually had. The 0202U, and that's a pathogen-specific nucleic acid, DNA or RNA. There's several different tests and lab tests, just so you know, that are proprietary lab analysis that I mentioned, and these actually became effective May 20th of this year, even though a couple of those were in April, but even though they're for 2021, because that's when you'll actually see them in the paper book. So we call those early release codes. And the editions aren't over yet, so we now have another mid-year code edition. And this is unprecedented. We usually don't get these code editions until they say, they are effective 2021. So we have an adrenal cortical tumor biochemical assay of 25 steroid markers. That's a 0015M. And then another oncology 0016M. And what they do is they put these on the website. So the AMA has these on their website as well, just making sure that you can have access to them. A couple of the things when I talked about prolonged services, one of the things that they're going to say is don't use in addition to, and they'll also talk about what the direct patient contact is going to be beyond the usual time. And then it'll tell you what codes you can use them with. They will also have prolonged clinical staff time, and clinical is the key, because I know a lot of people have said, oh, well, I saw there was going to be some new codes that we can use for patients when they come in and we have to fill out the paperwork. No. That's not a billable service. That is something that if you want to do an internal charge and patients know it's not a billable service, then that's something that you can definitely take a look at, but it's not something that would be a billable service. They're going to update some of the complex and chronic care management services as far as they're going to be very specific about that significant risk of death and functional decline, and make sure that there is not any kind of language in there that has allowed a lot of practices to make some money on services that were for patients that really didn't need to be monitored or coached because they were what's the word I'm looking for? They were stable, so very stabilized, and they didn't have an issue where you were worried about them being admitted to the hospital. Remember, when you deal with the complex care codes, it means that the patient is in some kind of a functional decline where they have to be monitored, and you want to make sure that they're not going to go back into the hospital. So it's not just that they have 2 or more chronic conditions, it's that the patient also is showing that maybe they're uncontrolled in their diabetes or in their hypertension, or the patient's got COPD and they're constantly calling, the ambulance to pick them up because there's a problem. So always make sure that you're aware of the spirit of the code and the intent, not just the actual language as well, because you just don't want to get caught in one of those audits I keep mentioning. But this is what we're looking at for the release. So always make sure that you get your CPT book. Just know, again, you've got 329 editorial changes, 206 new codes, 69 revised code descriptors, 54 deleted, and there'll be even more information, a press release. Your books come usually October 15th, and so it's always important to at least get them ordered before then. And I will have an update starting in November. We have to wait until November 15th to give you all the codes. They let us do like a teaser, and then we have to wait to give you the rest of the codes. So just be aware of that. I can't list everything out. I'm only allowed to tease a little bit of the codes, especially the ones that had early release, and then we're allowed to give you the ones later in November, right after the main meeting for the CPT and symposium. So they like to be the ones that get to spring it on you. I mean, it's basically, they're saying, it's not Christmas for you, it's for us first, and then we'll let you kind of send that out there. So I wanted to also mention something that came in from one of the podcast listeners, and I appreciate all of you. And this was a question that came in from a nice gal. I think it was Sarah. And she said, Terry, she says, I have a question for patients that are coming in and saying that their insurance is waiving copays until the end of the month. Is there any way that I can get a list of the insurance companies that are waiving copays or not? So here's kind of my response, and I'll really talk to you about this. And thank you, Sarah, for the question. One of the things that you have to always be aware of during the public health emergency is that things are fluid, and that means that at any time things could be rescinded. The public health emergency goes for in increments of 90 days. And so the last extension takes us to October 26th. But with the fact that we have such a decline in hospitalizations and people getting sick, yes, cases are up, but let's be clear, cases mean positive testing, and nobody's getting sick. I don't want to say nobody, but very few people are getting sick. If they are getting sick, they're usually over 75, 2+ or more comorbidities, but children are not getting sick, and healthy adults are not getting sick. And we know how to treat it when somebody does get sick. And if you've heard of anybody or know anybody that's gotten sick, like myself, it took about 2 weeks to recover. And again, back in February for me, and now, and then you feel fine. So there might be some lingering something, but I'm just saying that it's not the plague that they keep talking about. And we're at the point now where a lot of states have opened up to phase 3, phase 4, and we're really on our way. So in saying that, just in coming back to the question, what a lot of the insurance companies have done and the payers is saying, oh, by the way, the patient now has to pay their out-of-pocket. And all they've done is put it on their website. They haven't actually sent out that many letters. Some have, some haven't. So you really have to know who those payers are. And if your patients are telling you that they're saying that they don't have to, they can still have their copay waived on all services, not just COVID related, I would check it out. I would double check, make sure, verify, and have patients sign something, not really a waiver, but a financial agreement saying, okay, well, we don't have an opportunity or a chance or the time really to verify everybody's insurance on that. So as long as your insurance company, when we get our payment, doesn't put PR as the payment responsibility to the patient, then we're fine in waiving it as long as they're making up the difference. But if the company, the payer, is saying that they're waiving it, but they're not making up the difference on that 20% or that copay, then it's really optional if you want to, waive it for your patient or not until PHE is over. But you lose that revenue, so it's really up to you. For COVID patients, I totally get it. But for patients who are being seen for non-COVID related services, you don't want to get them into the habit that they don't have an out-of-pocket. Because as soon as the public health emergency is lifted, if you try to waive out-of-pocket routinely, it's considered a fraudulent act, and you don't want to get caught up in that. So make sure that if patients are telling you that either you verify or have them sign something that says it's going to be up to you to verify. We want you to to sign this and understand that if your explanation of benefits or when we get your payment on your insurance side says that you owe it, we're going right off of what your insurance company is telling us to transfer to you. So the patients really need to understand that you're only following their direction from their insurance payer. Otherwise, you could lose a lot of money. Okay, so I am back from Arizona. My daughter's all moved in, and it's a little sad for me, but I'm happy that she's, moved on with her own life, and it's really good, and boy, is my house quiet. So I just wanted to shout out to a couple of people just to say hi, because I really appreciate some of the comments I've been getting. Christina, this is on Instagram. Christina, Sarah, Julie, who else am I getting on here? Vicky, Caro. It's just really nice to really see some of the people, Christina, Anush, and Barbara. and just having everybody really reach out. Kat, it's always good to hear from you. I really appreciate that. Let me see who's on my LinkedIn here. I'm just kind of taking a look at who's sent me some really sweet messages lately. So we've got, and Don Self, shout out to you. Thank you. Dr. Schwartz, I've got Donna Walker. Thank you. And looking at Robin Sewell. Thank you, Robin. Davina, Marie, Sonell as usual. Her and I have a good conversation. Ashley Kim, thank you. And Kelly, Marianne. So just a lot of you that I really appreciate everything that you have done to really talk to me. Holly, thank you. Eric, Janet, and just I know there's many more of you, and I'll try to get you on the next episode. But I just really appreciate everybody that sends me a nice message. I actually got cookies in the mail from Ruth. Thank you. Those were so good. Yeah, there isn't a chocolate chip cookie that I don't like. Hint, hint. So I'm also a snickerdoodle gal, and I love coffee. So if anybody sees something that's something like that for me, I just let me know where to get it. I'm not hinting for you to send it, but I just really love to try new things like that in different parts of the country. So let me know. But I appreciate some of the really sweet little things that you all send me and say to me, and I can't tell you how much I appreciate that. So everyone, make it a great day, a great week this week. Try and be positive. It's September. We're getting into fall weather. And for those of you that have started Christmas shopping, I'm kidding. I'll stop. Let's get through Halloween first. But everyone, just have a really good week, and I'll talk to you next time on the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter @TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.